The government is rejecting calls to relax the coronavirus lockdown, saying the outbreak remains at a delicate and dangerous stage. Ministers are asking us to adjust to what they're calling a new normal for some time yet. The government is reiterating the current restrictions are having a positive effect, with fewer people being treated in hospital. Well, the latest number of dead is up by 413 in hospitals across the UK. It's worth noting the numbers often come down over the weekend because of a lag in reporting. The number of dead now stands at 20,732, not including deaths in care homes or the community in England and Northern Ireland. With more, here's our science editor, David Shukman.
In towns and cities, usually busy streets remain empty. A scenario set to continue as scientists warn that any relaxation of the lockdown would risk killing tens of thousands more people. The government insists on moving very carefully.
We'll end up moving to a new normal, and I think we will need to make sure that we can proceed in a sure-footed way, which is why I know the temptation to start announcing proposals now, but actually until you've got the evidence, that's not responsible. It risks you ending up misleading. I know you're not going to, but we need to take a sure-footed step forward which protects life but also preserves our way of life.
The key measure that all governments are worrying about is the rate of infection. A month ago in the UK, it was about 3, which means that anyone infected could pass it to 3 others. Since then, it's come right down to something like 0.7, crucially below the line of 1. Anything above that, and the virus takes off again. So what about the effect of easing some of the restrictions? Well, allowing public gatherings again would probably take you above that key line. But reopening schools might be possible and still stay below it. But no one's entirely sure. At today's Downing Street briefing, the government suggested that social distancing within schools might be an option, but wouldn't be drawn. Might it be that when you look at relaxing different measures, reopening schools might be one of the first things you consider?
Of course, school closures is one of those measures. I think it's highly likely that there will be different combinations of measures, some of which are in place at the moment, but others that you have heard about, such as more sophisticated track and tracing, that in combination will keep that number below 1.
All this is being assessed by the different nations in the UK. They may come out of lockdown in their own ways, but all face the same challenge.
Some of the margins we will be faced with as we start to ease things are very, very fine indeed. So there will be a need for real care and caution, and perhaps on some instances to go back again if we find that things that we have done have allowed the virus to run out of control.
Everyone is struggling to find an answer. In Germany, small shops are reopening. But at the same time, the German Foreign Minister has warned everyone not to expect a normal holiday on a packed beach this summer. And Sweden, which has allowed cafes to stay open, is now seeing the numbers of deaths rising. But it doesn't want to risk a public backlash. And some British scientists share that concern as the UK's lockdown drags on.
I think this is going to be a lot harder for people. In terms of the finances, I think quite a lot of people had some savings and were able to borrow from friends and family. Again, the evidence shows that as time goes on, that becomes more difficult. Also, if there are tensions between people, those can escalate, and we've sadly seen there's been a big increase in domestic abuse reports.
And all the time, warnings from countries that thought they had the outbreak under control. Singapore is now installing thousands more hospital beds after a new surge in cases. Until there are new treatments or vaccines, there's no easy way to deal with the virus. David Shukman, BBC News.
Well, our political correspondent Iain Watson is in Downing Street for us tonight. Iain, Boris Johnson is now back in residence in Number 10 after recovering from the virus. Is he expected back at work tomorrow?
Very much so, Clive. At 9 o'clock tomorrow morning, he'll be chairing a meeting of senior cabinet ministers and advisers, and he'll certainly have a very full in-tray, which we'll have to look at too. He also has to make some very big decisions on where he's going to go on the whole question of a lockdown. While Number 10 say, look, it's business as usual, many of his own MPs are worried about the effect the lockdown is having on businesses. Downing Street insiders are also suggesting that they feel a kind of restlessness amongst the wider public about some of the restrictions That said, I believe that the Prime Minister, when he finally gives us a route map towards easing the lockdown, will be very gently easing his foot off the brake because he fears fueling a second wave of infections. So the kind of thing that ministers are discussing behind closed doors are, for example, allowing a wider range of shops and businesses to reopen if they can ensure that good social distancing measures are in place. But Labour want to see a wider range of options discussed. That said, Clive, I think one of the early priorities that Boris Johnson is going to have, though, is to tell some members of his own party that he simply does not see a straight or simple choice between the health of the nation on one hand and the health of the economy on the other.
OK, Iain, thank you for that. Ian Watson there in Downing Street. Well, there remains concern among care providers about testing for staff and residents in care homes in England. The BBC has spoken to more than 200 providers, and 3/4 say none of their staff has been screened. Access to testing for residents also appears to be patchy. The government says more people will be tested. Here's our social affairs correspondent, Alison Holt.
At Harbour House residential home in Dorset, they're keeping one of their residents who's returned from hospital isolated. They've been in lockdown for weeks now and need to be sure that no one brings COVID-19 into the home.
What is it that you're doing now, Lana?
I'm going to see Brian, who is isolated for 14 days. So we put the personal protective equipment.
They've been told they need at least 2 suspected cases before they get testing of residents.
Hello, Brian. Can I come in, please?
And for staff, the nearest drive-through testing centre is a 3-hour round trip away.
These are fluid-resistant surgical masks.
This and continuing worries over getting enough protective equipment leaves the home manager at the end of her tether.
It's not good enough. It's really not good enough. The voices of everybody working in care, the NHS, the care industry, we need to be heard and we need to be saved.
The BBC has spoken to more than 200 care homes across England. Of those, 159, that's about 3/4, said up to last Wednesday none of their staff had been tested for COVID-19. 127, so nearly 2/3, said they'd seen no screening of residents in their homes. Care providers have told me with some homes already seeing a high number of deaths from coronavirus, testing is vital to combat the infection.
The only way to do that is to ensure that we have testing for everybody in the service. We can mitigate risk, but we can't eliminate it without the support of having accurate testing available to the services.
The government says it's introduced mobile military units to provide testing in places like care homes and that residents returning from hospital are being screened.
On testing, we have been ramping up our capacity to do those tests. Currently stands at over 50,000 a day, and we have started to invite large numbers of people now working in the care sector and care homes to undertake those tests, and significant numbers have.
With care homes on the front line of tackling the virus now, the pressure to get more testing on the ground quickly is intense, and it's unlikely to go away. Alison Holt, BBC News.